Hello and welcome. My name is Louise Fetchu, the Family and Community Engagement Coordinator with Kent City Schools District. Thank you for being here today. We do have the pleasure of having Jalessa. She is the Accreditation Coordinator for the Kent City Health Department. She's going to be educating us today about vaping, tobacco legislation, and just some general education so us as parents and caregivers have a better understanding of what's going on right now. So without further ado, I will let Jalessa take it away.
There we go. Hello, everybody. My name is Jalessa Caples. I'm the Accreditation Coordinator for the Kent City Health Department. I also coordinate our tobacco use and cessation grant here for the county. So that's for all of Portage County. So we do work pretty much everywhere. And especially we try to work with every school district. So today I'm just going to be talking to you guys about some vaping, some tobacco information, some legislation, and more. So this is a little bit of a teaser for an event that we're having on the 22nd of February at Stanton Middle School in the auditorium. And if you're interested in that event, Louise knows more. We have a flyer out there. You can always check our social media as well. And with that, I will go ahead and get started. So just to give you guys a little bit of background, about tobacco and e-cigarettes slash vapes. So tobacco 101, just a little bit of information. So nicotine is the primary addictive substance in tobacco products and vape products and e-cigarettes. So that's important to know because with vapes and e-cigarettes especially, there are things, a lot of different ingredients and things that we don't exactly know what they are, but we do know that nicotine is the one primary addictive substance in those. And then there are more than 7,000 chemicals in tobacco and tobacco smoke. So this little graphic down at the bottom just shows some different models and modes of tobacco products and e-cigarettes slash vapes. So as we've gone on through time, they've of course, adapted and changed up a little bit. So this is a good representation that shows the different stages that they've gone through. And of course, it has the regular disposable cigarette, of course, which is the model for everything. So then let's talk about e-cigarettes a little bit, e-cigarettes and vapes. So the E in e-cigarettes, of course, stands for electronic. So it's an electronic cigarette slash vape product. E-cigarettes are sometimes called e-cigs, vapes, e-hookahs, e-pens or vape pens, electronic nicotine delivery system. Ends, you might see that more with medical stuff, and especially with the CDC. If you see any CDC guidance, sometimes they will use ends. So I just wanted to make sure that you guys knew what that meant. And so that when you see it, you establish that it's a connection between that and e-cigarettes slash vapes. So yeah, let's talk about flavoring in vape shops a little bit. Um, so flavoring, e-cigarettes and vapes come in a wide range of flavors. The picture in the top left corner just kind of shows like the ingredients of vape juice. So as you can see, there's a little bit of nicotine, there's a little bit of natural slash artificial flavoring, and there's some PG and some VG, which I'm not sure exactly what those stand for, but you can look those up. But yeah, so that's a graphic from the CDC that basically just kind of breaks down the components of the flavoring and the juice that's within a vape product. And like I said, there are definitely some things that are not clocked and things that we don't know. Ingredient wise. So e-cigarette companies encourage youth to purchase e-cigarettes through gourmet kid friendly flavoring. So a lot of the times, and we'll talk about this on a different slide, I believe, but they'll come out with like gummy bear flavored or fruit flavored or bubblegum flavored, which, your average adult is not looking for those flavors. It's really the kids that they're targeting with those flavors. So that's really important to note and notice. So we'll talk about some ways that you can kind of identify if your kids are vaping. So one way is, of course, through smelling that that light fruity scent, because like I said, they do have different flavors. And so sometimes you can smell it if it's been used recently. So that's one way that you can maybe tell if your kids are vaping or if they've been around vapes, if they come home smelling like, certain flavors and things like that. So exposure to cinnamon flavor actually causes significant cell death. So that's important to note because, of course, there are cinnamon flavored products out there. And again, these are targeted towards youth and younger people that are enticed by that flavoring. So the effects of long-term exposure to chemicals in e-cigarettes are unknown. So there's not a lot of information about the long-term effects of e-cigarettes in vaping. So of course we're always, looking for new information. We're always trying to get the best and most accurate information. So yeah, just be on the lookout for, some causes, some effects of long-term exposure, because who knows how, in 10 years, 20 years, what information will actually come out about that. So what are vape shops? So some of you that live in the city may have noticed that we've got a couple of vape shops, a lot of vape shops popping up in downtown and in the perimeter of the city. So I just wanted to make sure that everybody knew what a vape shop was. So a vape shop is basically a shop, a retail outlet, either physical or online, because there are online vape shops that specialize in selling vape products. So they specialize in selling those e-cigarettes. They specialize in selling those vape products. That the hardware that comes along with it. But they do sell other things as well. So what are some other things that they might sell?
Mhm.
Disposable nicotine vape products, of course, like Elf bars, Juuls, Evo bars, Geek bars. Those are just some of the very popular brands that you might see. So if you see, if your child is coming home with things that have these labels on them, now you know that they're vape products. So they have some derived psychoactive cannabis products. Um, they have hardware that includes pod systems, glassware, nicotine/marijuana pods, all of those things, mushroom byproducts. So we recently learned that some vape shops are selling mushroom byproducts, which are basically they're kind of like candies that are derived from mushrooms. So important to know that they do have some effects, and at this point we know that um, there's no law at this point in time that like limits who can buy those. So we have some youth going into some vape shops and buying some of these things. And unbeknownst to us, there's no actual laws or anything that can kind of keep them from that. So that's why we want to make sure they inform the parents, so that way you guys know and you can kind of monitor your kids.
Well,
So
hey,
they, of
Jalessa, just
course,
a
oh,
great
sorry,
question
go
on
ahead.
that. Sorry.
No, you're
Um,
fine.
when you say there's like no law, that means like there's no age requirement, like there's no age limit
Right.
to purchase, right?
Correct.
Wow, that's alarming.
Yes,
Um,
very alarming.
and just for anyone else too, if you guys have questions, like this is for our parents, our caregivers. So please feel free, pop those questions in the chat. Go ahead, unmute yourself, ask those questions. We want to create a safe space. If you don't feel comfortable asking your question directly, you can send it to me as a private message in the chat, and then I can go ahead and ask. So sorry, yeah, just some
Absolutely.
alarming,
Oh, no, no,
alarming
no.
information that we're learning here today. So
Yes.
thank you for that.
And absolutely, if anybody has any questions or any comments, please feel free to come off of mute and interrupt me at any time. Because I know that some of this information is pretty devastating and sad. And I would love to hear your feedback and things that you guys have to say about that. So yes, feel free to interrupt me at any point.
Thank you.
And then at the bottom, there's so much more in red that we can't keep track of. So vape shops are selling things that, again, are unregulated in the United States, especially when it comes to like CBD oils, is what we're finding is that CBD and sometimes even marijuana infused things are not directly guided under law. So there's some leeway there with who the vape shops can sell to. And of course, we're always trying to connect with the state to make sure that we're up to and abreast of everything that's going on, and especially with laws and legislation, so that way we can enforce as much as possible. So let's talk about some current laws and regulations. So federally, thank God, in 2019, the federal government did increase the legal purchasing age of tobacco products slash nicotine products to 21. So that was a great victory. So then let's talk about some going lower than that. Let's talk about the city of Kent. So recently there was an ordinance to increase the legal purchasing age within the city of Kent to 21, and that was before the federal law in 2019, and we passed that in 2018. So Ken has always been very on the ball as far as laws and ordinances goes around tobacco products and tobacco programming and things like that. So that's pretty awesome. So there was also an ordinance to implement a tobacco retail licensing policy in 2020, I believe. Yep, it was 2022. And so from there, we have been having our TRL program, our tobacco retail licensing program, and we've been implementing that. And this is now our second year. So we passed the ordinance in 2022, and then things went into effect February of 2023. And since then, we've been doing all that we can to keep this program going and running. And so our tobacco retail licensing program, we actually do compliance checks. So we will take a trained underage purchaser to vape shops and tobacco retailers, and we will have them attempt to purchase tobacco/nicotine products. So that's one way that we're able to kind of enforce, or we were able to enforce, because as we'll get to at the bottom, there was recently an overturn of the governor's veto, and it made local tobacco ordinances pretty much illegal. So we'll get into that in a little bit. But we also passed an ordinance to limit the number of tobacco retailers within the city of Kent. Right now, there are, I want to say, 26 retailers open. When we started, there was about 30. So some of them have gone out of business. And before the local laws were overturned, or will be overturned, we did have a measure in place, which basically just limited the number of tobacco retailers within the city to a comfortable number of 20 instead of 30/27/28. So that's really important to note. So the city of Kent has done all that they can to ensure that there's some type of regulation. Of course, some things are out of our control, but you can safely know that your city council has done everything that they can do, really, to try to implement um, some some protocols when it comes to tobacco. So then recently at the state level, there was an overturn of a governor's veto, making local tobacco policies, laws, and ordinances basically illegal and null and void. So basically, it gave the power back to it gave power from the local government back to the state government to make those rules and policies. So basically, if there's going to be any type of tobacco retail licensing policy, limit on the number of retailers within cities, all of that is going to now have to come from the state. So you might have seen some buzz about it. A couple of weeks ago, we were trying to get as many people as we could to contact their local representatives, to try to, let them know that, we didn't want this. We want to be able to keep local tobacco control in-house. But unfortunately, that's not the way the things went. So basically, that backtracked all local ordinances for the city of Kent and statewide. So we're not the only place that had a tobacco retail license. We're not the only place that had a proximity/density ordinance, which limit the number of tobacco retailers within the city. So we were not the only ones affected by this. There were at least 17 other communities that are affected by this, that have the tobacco retail licensing policy and program going. And now we'll have to change and switch gears a little bit, because we can still run these programs, but the way that we run them will be different. So for compliance checks, under our TRL, we were able to fine these places for selling to underage youth. Now we're not able to find these places. So the consequences are a little bit less dire. And it kind of just all reverts back to, like, the one law that the state has is that if an underage purchaser is sold to, then the person that sold to them is in trouble, not that the whole establishment is in trouble. And in reality, we want the whole establishment to really take accountability for all of that, because they are the ones that are in charge of training their people and making sure that they know the rules and the protocols. So yeah, that's just some basic. We'll talk about this more at our February 22nd event, and we'll go into more detail about it. And of course, if you have any questions, please feel free.
Yeah, it's reassuring to know that the city has taken it so seriously and put such restricted ordinance on everything. Do we have any insight currently where the state is at in regards to the number of vape stores they're going to allow per cities, or like any clarity if like their standards are going to be in line with what the standards we had already put forth?
So we haven't heard anything specifically as of
Okay.
yet.
Yeah.
I unfortunately am not very hopeful that the state will put something like that in place. Really for them, it's more of like they don't want to limit local business,
Mm-hmm.
which
Yeah,
is always, yeah, a thing when it
yeah,
comes to Ohio government. They're really big on like local businesses,
yeah,
and so they see these as a threat to local business. So we will definitely see how things play out. And the health, like I said, the health department is always in contact with the state to try to make sure that we get that information as soon as possible, so that we can release it to the public.
yeah. So now more than ever, this education is so important and imperative
Yes,
for us as parents and caregivers to have. So, okay, yeah, thank you.
of course. So let's talk about some actions that you guys can take. Just these are not this is not the broad overview, but like I said, we will go into it more at our February 22nd meeting. This was really just the teaser to kind of get you guys interested in, hopefully see some of you guys out at that event. But basically some actions that adults can take to decrease youth vaping. You can talk to your child about quitting, about vaping in general. Really having those open, honest discussions about vaping and the effects of it, and if they are vaping, quitting, if they have friends that vape, encouraging them to quit as well. So basically also encourage your child to utilize the resources that are out there, and we'll kind of go over some of the resources that are available for youth specifically. So thankfully there are some youth specific things that are out there, programs and things that are helpful. Answer their questions. Be honest with them. If they come to you and ask you questions about things, even if you don't know that, let them know that, hey, I don't really know it, but I will get back to you on that. But make sure that you are getting back to them on that. Make sure that you're having those conversations with them. Make sure that you're open about it. Don't try to hide it. Because they're getting exposed to it every day, out in the world. So it's really important to take control of that and get it by the reins. So start the conversation. Talk to them about vaping, if they're vaping, if their friends are vaping, if they're getting peer pressure to vape. Really, I know those conversations are hard to have, but it's really important to have those conversations and then build that trust between you and your child, so that if they are ever peer pressured or they get the inkling to start vaping, they come to you first as a resource and as a guide for that. So keep the conversation going. Make sure that you're starting that conversation. Make sure that you're also keeping it going, and make sure that you're open to continuing the conversation, beyond that first conversation. Because again, you're throughout their lives, your kids are going to get peer pressure. They're going to get different outside resources that are on them about possibly starting to vape or getting them interested in vaping. So it's really important to keep those conversations going. So here are some youth resources. So My Life, My Quit is an amazing youth resource. They provide counseling, for all forms of nicotine/tobacco use. The coaches are trained to address teen quit needs. So of course, quitting for adults is completely different than quitting for youth. So adults really have some options when it comes to like medications and different things like that that youth do not have, because those things are not set up for youth. So this program is specifically set up for youth to help them quit. So there are 5 coaching sessions, um, there are live text messages or by phone, or by online chat. So through these 5 coaching sessions, they will get tools and tips on how to quit, and how to fight off those urges to continue. So it's really easy to get started. All they have to do is text "Start My Quit" to 36072, and that kind of starts the process for them. There's also a way, like if you I don't know how comfortable everybody feels, but of course we're always really careful with youth information. There is a way for us to kind of request that My Life, My Quit reach out to your child, or there's a way for you to request that My Life, My Quit reach out to your child. There's an online form on their website, and if you're ever interested and feel like your teen or your child might not be able to get it started themselves, having My Life, My Quit reach out to them might be a better way of getting that started.
Also,
So the Kent
the
City
school
Health, oh,
counselors,
sorry, Louise.
sorry, that's okay. The school counselors are also aware of these programs as well. If you need help to make those connections for you or your child, reaching out to your school counseling department, whichever school that your student is at.
Thank you for that, because I did not know that. That's awesome
Mhm.
information. And I'm so happy that you guys have that have those people to provide those resources and those connections, because I know that it can be scary, like trying to reach out to me, a person that you've never met before, but your school counselor is somebody that you might interact with frequently. So yeah, that's super important and that's amazing. So the health department has some tools and resources as well. We have My Life, My Quit cards. We have posters. We have anti-smoking slash vaping coloring books. We have pamphlets on pretty much anything that you could think of. Vaping, regular vaping, vaping THC, um, regular tobacco. We have resources on just about anything. So if you're ever in need of any resources or you just want some more information, and think that maybe your youth could benefit from some of these resources, reach out to me, reach out to Louise, have Louise reach out to me, whatever is needed to get your child what they need as far as resources. Okay, so then I just wanted to open it up for questions.
Yeah, we do have a few more minutes for questions. Thank you so much. Just so much good information. And you know what I didn't think about is like being around those fruity smells and things, that being a trigger that, the person I might be around could have just been vaping or vaping with friends or been around someone who is vaping because it's just not like when I was younger, right? Like you could definitely smell like a cigarette, like
Right.
you knew that smell. So knowing that is something to keep an eye on is it's good to know. So let me check the chat to see if I have any questions coming through. If we have any parents or caregivers on the line and you want to unmute yourself and ask your question freely, please feel free to go ahead and do that. And while we're waiting for any more questions to come in, I just wanted to remind everybody next Thursday evening, so February 22nd, we will have Kent City Health Department here at Stanton Middle School in the auditoria from 6 to 7. And they're going to do an in-person session on vaping. I know Town Hall 2 will be there to share some resources. We have somebody coming from the medical perspective to offer their education in regards to like what vaping does to your body, just to see the great effects it has, and what we do know, because right now, there's not a ton of medical research on it, but what we have found, right? So just educating parents on that. So once again, that is next Thursday, February 22nd from 6 to 7 in the Stanton Auditoria. And you don't have to pre-register or anything. You can RSVP tentatively, but you don't have to if your schedule frees up that night and you want to come. I don't have any questions coming through in the chat and I don't see anyone's hands up. So if I missed you, I do apologize, but I think you covered so many of our questions just in your presentation.
Well, that's awesome. I always love that.
Yeah.
And then so if everybody has time, I'm going to also drop it in the chat, a link. But if you have time, there's just a quick 3-question evaluation, basically just to make sure that I hit all the components that I needed to hit,
Yeah.
and you feel like you got anything out of this. It does help our grant work, so thanks for anybody who completes it. And I will go ahead and put that in the chat.
And I will also send out the full presentation that was done today will be emailed to everybody and also the survey. And then it will be uploaded to our YouTube channel later this week for later viewing and sharing. So once again, I would like to thank Jalessa for being here today from the Kent City Health Department, educating us on vaping and some of the laws and legislation behind that. Be sure to check out the Kent City Health Department next Thursday, the 22nd, Stanton Auditoria from 6 to 7. So thank you all very much. Please reach out to either one of us if you have any questions. And with that, have a great day. Thank you.
Thank you both. Have a good day.
Thanks.